Good morning, everybody. Welcome to ARI Discussions. My name is Ellen Bruno. I'm a cooperative extension specialist in the Department of Agricultural and Resource Economics at UC Berkeley. Thanks everyone for joining today. ARI Discussions is a webinar series that is open to all. We host experts on various issues, economics issues facing California's agricultural and natural resource communities. This series is being organized by the 4 cooperative extension economists in the UC system. Brittany Goodrich and Tina Saitone are at UC Davis, Mehdi Damati at UC Riverside, and myself. Our meeting will run for an hour and 15 minutes. We're going to do guided Q&A with each of our speakers, followed by questions from the audience afterwards. Please submit your questions for the speakers through the Q&A function at the bottom of your screen. This webinar will be recorded and it'll be available on our website afterwards, aridiscussions.ucdavis.edu. So today we're joined by 2 excellent speakers who have research measuring the impacts and costs of air pollution to human health. We have first up Dr. Michael Anderson. He's a professor in the Department of Agricultural and Resource Economics at UC Berkeley. And he has research that spans topics in applied economics from health to transportation to the environment. And then we'll hear from Dr. Eric Edwards. He's an assistant professor at North Carolina State University. And he's a water resource economist, but he has research studying how water transfers in Southern California have contributed to dust-related air pollution. And so we're delighted to have you both here. Thank you so much for joining us today. Before we get started, we just want to take a quick poll to see who's in attendance today. So if you can just take a minute to answer these 2 questions, and then we'll kick it off. So a mixture of folks in California, some academics, cooperative extension folks, ag industry. Great. All right. So I'm going to stop sharing here. Oops. And so yeah, let's get started. Michael, if you want to get your slides open, you're welcome
Sure.
to do so.
Give me a second here.
Great.
Okay.
So I was hoping to start off by asking you about, why exposure to air pollution is bad, and sort of tell us, what the problem is, and like from a policy perspective, why do we care about the impacts of short-term and long-term exposure to air pollution?
Sure. Yeah, so that's a great question. I mean, I think, we've known for a long time, probably well over 100 years, that potentially exposure to pollution has negative health impacts. I think a lot of the question sort of in terms of the research focus has been quantifying both how large those impacts are, just from sort of a public health perspective, and then also quantifying sort of how important they are from a policy perspective. And so one thing that I like to sort of start out with when I'm talking about the research study that is being referenced today is just sort of thinking about some of the most important environmental regulation in the United States. So if you go back several decades ago, there was like relatively minimal regulation, environmental regulation in the country. And sort of one of the landmark pieces of policy is what's known as the Clean Air Act. And so there have been many like cost benefit types of analyses of the Clean Air Act in subsequent years. And it turns out that the effect of air pollution on mortality is really sort of a fundamental ingredient for determining the benefits of the Clean Air Act. So just to give sort of some numerical examples, the EPA estimates that the Clean Air Act amendments, this is not even actually just the original Clean Air Act, it's like the improvements, further like restrictions that were added to it later. But they've estimated that these amendments can generate something on the order of like $12 trillion in gross benefits from 1990 to 2020. So to be clear, that is over a 30-year period, but whenever you're talking about multiple trillions of dollars, those are large numbers, right? US GDP is only about $20 trillion. So you might ask, as I have sort of in the past when I read this, where are all those benefits coming from? And if you actually kind of drill down into the analyses, it turns out that over 90% of them are basically sort of accruing from assumptions about avoided mortality. So basically lives saved because we have better air pollution regulation. So just to give an example, like they project that something like 230,000 cases of premature mortality were avoided in 2020 alone. And there were about 2.6 million deaths in say 2013. I don't think that's changed too much. So you're basically talking about, almost in terms of order of magnitude, almost like a 10% reduction in mortality rates just from the stricter air pollution regulation. So certainly from a policy perspective, it's super important to understand, what the actual like causal effects of pollution on health are. There's been a lot of focus on essentially thinking about the effects of short run changes as opposed to long run changes in pollution. And one thing that's sort of really important here is that the effects of sort of a short run shock to pollution versus a long run change can really be fundamentally different. So there are two problems with focusing on short run changes in pollution when you're trying to sort of figure out what the impacts of lowering pollution for long periods of time is. So just one example, when we talk about a short run change in pollution, typically we're talking about some sort of relatively brief episode where there's a pretty substantial spike in pollution levels, right? So sort of in modern times, in California, most of us are aware of, say, the wildfires, right? Where, there'll be like really bad wildfires and the wind patterns will change and, the Bay Area or Los Angeles will be hit with an AQI of 200 for like several days or something. Obviously, that's not healthy. We all try to avoid it. But it's not really the same as being exposed to somewhat elevated pollution levels for years and years on end. So a sort of a classic example of this was what was known as the Great Smog of 1952 in London, when due to sort of a variety of weather conditions and so forth, there were extremely elevated pollution levels, and they could actually document that there were some excess deaths during that period. But there's sort of two problems when you're focusing on these short run changes. One is that, if you sort of think about what you might find. So on the one hand, you might find that there's a short-term spike in pollution and that isn't correlated with an increase in deaths. It's not clear what you conclude from that, right? Because maybe that just means that there wasn't sort of a long enough exposure period. And so there could still be effects from long run exposure on mortality. On the other hand, and this is maybe a little bit more subtle, like if a short-term pollution spike is related to death. So you see a spike in pollution and then you see an increase in deaths. It's actually not clear what the implications of that are for long run exposure. And the problem is that it's very hard to say how much longer the people who died during that pollution spike would necessarily have lived, right? We kind of intuitively understand that, if say like there's really bad smoke from the wildfires for a week and you see an uptick in deaths in the Bay Area, those deaths are probably concentrated amongst people who are, very elderly, maybe very sick, already have heart disease and so forth. And these are people who probably didn't have very long expected lifespans anyway, even regardless of whether or not there had been a pollution spike. And so going from sort of that short run impact to then a kind of long run effect can be very misleading potentially. So from a policy perspective, really what we're interested in are the effects of long run sort of sustained changes in pollution, because that's hopefully what our policies are actually going to induce.
Right, that makes a lot of sense. Thanks for explaining that. So what is it that makes it hard to try to really pin down how health effects are impacted by air pollution, and actually identify that air pollution was the cause of the health impacts or deaths that you might observe? So why is that hard? And then additionally, could you elaborate on this element with the long run, and if there are any additional challenges with trying to pin down a long run of causal effect?
Yeah, so right. So in general, I think in any sort of say empirical research or public health research, right, there are always concerns about what economists or statisticians refer to. Sometimes it's like selection bias or omitted variables bias. Just the basic idea that, say in the case of pollution, if you compare an area or a time period that has high pollution to one that has low pollution, and then try to ascribe all of the differences in sickness or in mortality between those two areas to the pollution, it's hard to say whether or not the differences are due to the pollution itself, or whether they're due to kind of other factors that might affect health and be correlated with pollution, right? So if pollution happens to concentrate in poor neighborhoods, for example, and then poor neighborhoods have higher mortality rates, we don't know how much of that is due to the pollution and how much of that is due to just differences in, like things that differ across neighborhoods and may affect health. So like access to healthcare or diet and all those other things, right? Mm-hmm. So because of that, economists are always looking for what we call like natural experiments, right? So we want to find some sort of change in the pollution level that is maybe sort of sufficiently abrupt that it's unlikely to be correlated with anything else that's simultaneously changing. And so there's sort of two sets of questions that, at least in the economics, kind of health economics literature and environmental economics literature, have been addressed with great success, I would say. So one is sort of thinking about the effects of short-run fluctuation in air pollution on neonatal or infant health. And this is feasible because by definition, infants haven't been alive for very long. So a short-run fluctuation can actually meaningfully change the sort of total exposure that they've received over pollution exposure they received over their lifetimes. There have also been studies that look at the effects of short-run fluctuations in air pollution on sort of contemporaneous child or adult health. So this is, again, the idea being like, hey, if we maybe have a wildfire that causes extreme levels of pollution in San Francisco for 1 week, do we see an increase in, respiratory admissions at hospitals simultaneously? And so the reason, that we've had a lot of success in answering these questions is because we have found these natural experiments that basically sort of generate plausible, what we think of as kind of random short-run fluctuations in pollution levels that assuage our concerns about these omitted variables bias kind of problems. If we move to then trying to estimate the effect of long-run pollution exposure on health, that turns out to be quite difficult. So there's sort of two problems here. One is that, you're going to need basically sort of variation across space, because you want people to sort of be in the same location and exposed for long periods of time to these different pollution levels, right? So you need spatial variation in pollution. It needs to be consistent, because if it's not consistent, then of course, like it's always just the sort of pollution, the elevated pollution levels are just kind of moving all around, then everybody on average over time is going to be exposed to the same levels, right? And you won't have any comparisons that you can make. So you need it to be consistent, and it has to be sort of large enough. The variation, needs to be like substantial enough to plausibly affect human health. And of course, we want it to be at least not obviously correlated with other factors that might affect health, so that we can kind of set aside many of these omitted variables bias concerns. At the same time, the variation in pollution needs to be in some sense subtle enough so that residents aren't sort of induced to potentially move away from the higher pollution areas to avoid it. Because as soon as you get people sort of moving in response to the pollution, that changes potentially the composition of people who are living in that area. And then that's just going to, again, further complicate any types of analyses you might do, because now you're comparing a low pollution area where everybody stayed to a high pollution area where a bunch of people have left. And it's probably the wealthier people who had the means to leave and So obviously then, you're not going to be comparing apples to apples at that point. So these two requirements are in some sense in direct conflict. And so there has been, a large body of work that just does look at spatial differences in pollution levels and mortality rates. That's what kind of informs that EPA calculation that I mentioned earlier about, 230,000 avoided deaths from the Clean Air Act. So one of the most famous papers, which I've just reproduced kind of the main table from, or figure from, is what's known as the 6 cities study. So literally they just got data from 6 cities, measured pollution levels in those cities, and then measured kind of like long run mortality rates over 15 years in those cities. And so on the x-axis here, you basically have pollution measurements. On the y-axis, you have like essentially mortality rates. And you can see there's a strong positive correlation here between the pollution level in a city and the mortality rate in the city. So that's certainly suggestive that pollution, long-run exposure to pollution is not good for your health. But of course, you can come up with many, many stories about how these different cities, or how these high pollution cities, are different from the low pollution cities, and how those differences might be generating some of the observed difference in mortality rates.
Michael, were you trying to show us the figure, because we weren't seeing the figure?
Oh, really?
Yeah.
Huh. Sorry, I'm not quite sure what is
happening
happening then, because
yeah,
it's like I can see it on my screen.
Yeah,
I don't know, maybe it's just a format that doesn't.
Yeah, no worries if not. We're seeing
Okay.
like the title slide of your slides still. So just.
Oh wait, you haven't seen any of the slides?
No.
Yeah,
I'm still seeing as the wind blows title slide.
Okay. Sorry, let me see. So now, what do you see now?
Yeah, we see it's not in presentation mode, but we're seeing.
But you see, okay, I'll just keep it. Okay, I'm not quite sure why that's happening, but let me just keep it not in presentation mode so that. Okay, so perfect. So now you see the figure that.
Yeah, now we see it.
Right. Okay.
Yeah, perfect.
Great. Thanks for letting me know.
Yeah, great.
Okay.
Cool. So let's like dig more into the actual study that you did to try to get at some of these things, and like, could you tell us sort of what features about it make it a nice feature to tease out these long-term causal impacts?
Yeah. So the goal of the research is to measure the effect of long-term exposure to air pollutants on adult mortality rates. And so we want to see, hey, if we compare like a higher exposure area to lower exposure area, how does that have an impact on mortality rates? The way that I go about doing that is to essentially exploit the location of households relative to major highways in the Los Angeles area. So there's actually a lot of established literature in the kind of atmospheric sciences space that shows that particulates, and particularly what they call like ultrafine particulates, are elevated downwind of highways, but rapidly decline upwind of highways. So this is, intuitively makes a lot of sense, right? We know there are hundreds of thousands of cars passing every day on these major highways. And of course, depending on which way the wind blows, you'll either be sort of exposed to a lot of whatever is coming out of those cars if you're downwind, or not if you're upwind. And so what we do is we exploit that to then sort of compare the downwind, more polluted areas to the upwind, less polluted areas. The nice thing about that comparison is you're really sort of limiting the comparison to parcels or to houses that are all close to the same highway and are all concentrated in the same area, in the same neighborhood. So that hopefully addresses a lot of these concerns that we might typically have about sort of different confounding factors that might be correlated with the level of pollution. Because again, these are houses that are within hundreds of meters of each other. They're quite close to each other, and so they share the same neighborhoods and school districts and socioeconomics and so forth, right? So what we do to actually implement this is basically compute the mortality rates by census block. So you can think of that in Los Angeles here as being basically a city block. So we're basically computing mortality rate for each city block in the Los Angeles area that lies close to a major highway. And it turns out like the median household in the sample has lived at the same address for about 2 decades, or actually over 2 decades. So for a lot of these people, this is a sort of very long run exposure period potentially. And then what we're going to do is measure the relationship between the mortality rate in a city block and the frequency of time that that city block spends downwind of the highway, right? So in the sort of extreme example, if the winds were always blowing in one specific direction, then some city blocks would be one downwind like 100% of the highway, 100% of the time, and other city blocks would be downwind like 0% of the time. Now that's the most sort of extreme example. I don't think it really occurs in the data because of course the wind can change direction and then sometimes it's not blowing at all, but that's the kind of thought experiment that you'd want to have in mind. Mm-hmm. So as I said, this is going to focus on Los Angeles, which turns out to be an ideal study area for several reasons. It's about 400 square miles, so 20 by 20. It's bounded by the ocean on the west and the south, and then the mountains on the east and the north. And it has a large population concentrated within those 400 square miles. So it gives us kind of a big sample to work with. There are lots of major highways. Famously, Los Angeles is like what people think of as kind of where the car culture or addiction or whatever you want to call it in the US started. And furthermore, there are sort of consistent and predictable wind patterns across the basin. And so that's going to give us, again, these kind of consistent differences in pollution exposure by different city blocks when they're right next to the highway. And so this is just kind of a map that actually shows like each blue dot there is basically a city block that appears in the analytic sample. And so you can see, basically we're just going to focus on you can basically guess that the lines here that are being mapped out by these blue dots are the major highways in Los Angeles. And so we're just focusing on city blocks that are located very close to these major highways.
Cool. Yeah. So what did you find?
Yeah. So basically, we found significant effects of downwind exposure on mortality rates among the elderly. So the kind of main result is that a doubling in downwind exposure from the average level increased the mortality rate amongst 75-plus-year-olds by about 6%. The majority of that, as you sort of might guess / hope, is due to cardiorespiratory mortality, as opposed to things like, say, cancer, which is something we wouldn't think would be that strongly affected by pollution levels. And we did, of course, lots of kind of robustness checks to see if we use different definitions of who's elderly or who's near elderly, or kind of made what we call kind of a spatial bandwidth around the highway. So, how far we're going away from the highways to include city blocks in the sample. Sort of playing around with all of those different choices doesn't yield like substantially different results. And just to kind of graphically summarize the results, this is a figure that is essentially kind of plotting the mortality rate for a city block while controlling for some other things against, on the x-axis, the average downwind frequency of that city block. And you can see that, there's a pretty strong positive relationship there. So the more downwind you are, more often your city block, I should say, is downwind from the highway, then the higher mortality rate it tends to have.
Great. So yeah, so what are some of the policy solutions to this problem? And I guess I'm curious if you can draw any connections back to the Clean Air Act. What are some of the policy implications of these results? Yeah,
yeah, those are both important questions. So in terms of drawing or sort of putting the results in context of what I talked about with the Clean Air Act at the beginning, it is, I think it's interesting. So there's a lot of sort of underlying calculations here, but certainly, one thing that we did is compute hey, how strong of a relationship are we seeing here between the pollution in our study and mortality rates? And how does that compare to the estimated relationships between pollution and mortality that we saw in some of the previous papers that have gone into the Clean Air Act? Just kind of, the numbers vary, but I would say kind of the overall picture here is that the estimates that we have, while certainly statistically significant, and also I would say, economically significant or significant from a public health perspective, they are smaller than the estimates that have come out of some of these previous studies, like that 6-city study that I put up the figure for before, right? So that suggests that, maybe the benefits that you see, maybe the numbers that you see used for those benefit calculations in the Clean Air Act, they might be, the truth, it's possible the truth could be somewhat smaller than that. That being said, of course, when you're talking about $20 trillion, you could be, 2 orders of magnitude smaller than that and still have very large benefits. So, I don't want to, in some sense, diminish in any way the policy import of the Clean Air Act. There's also another caveat that I should mention, though, which is that the pollutant that is potentially sort of varying here in my study is really these ultrafine particulates, which are actually even smaller particulates than the fine particulates that most of these previous studies are looking at. And so this is not sort of a direct apples to apples comparison when we compare like the previous studies versus this study. So that's an important caveat. In terms of policies, I mean, I think, honestly, the one that is directly applicable right now, and obviously, if we think about it, it's becoming increasingly important, even in just the last few years since I completed this paper, is that, so clearly, like we already knew, highways are kind of pollution hotspots. Certainly this research suggests that pollution has negative health impacts on households that are sort of located in the quote unquote wrong place, near the highway and often downwind. But it's easy to imagine, a future world in which we move from internal combustion cars to electric vehicles. And of course, that's going to eliminate the pollution hotspot. And hopefully it eliminates pollution everywhere in the sense that, like, ideally they'll be charged via renewables rather than via natural gas-fired plants in California, certainly rather than via coal-fired plants in the Midwest. But regardless of sort of where the electricity has been generated, at a minimum, you are kind of removing this big source of pollution from a very densely populated area, and that can only have a health benefit. So interestingly enough, if I do a back of the envelope calculation that compares sort of the potential health benefits of going to switching a vehicle from gasoline to zero to battery, zero local emissions, the sort of order, like the number I get is not that different from the current federal tax credit for EVs. Now, I'm sure that's a complete coincidence. I'm sure that they didn't draw up, the current one is $7,500 per vehicle, right? And I'm sure they didn't draw up that credit by trying to think about like potential health effects. But I thought it was an interesting coincidence.
Yeah, interesting. So I know you have to go early, Michael, but I'm wondering if you could just take one quick question from the audience.
Sure.
Someone asks, what might explain the smaller sizes or the smaller estimates from your study versus some of the other studies?
Yeah, no, I mean, great question. So, I think there's a variety of possible explanations. First, as I already touched upon, we're actually looking at different pollutants. So that's always, one possibility. We're probably also looking at kind of different areas and what like epidemiologists might call sort of the dose response function, which is to say that, if you have say 10 microgram per meter cube reduction from 100 versus a 10 microgram per meter cube reduction from a baseline level of like 20, those two reductions might not necessarily have the same impacts. There is, of course, also the possibility that, some of these previous studies, I think, had study designs that were maybe less robust to potential confounding factors and omitted variables and so forth. And so maybe some of the previous results that we've seen are kind of contaminated by these factors in ways that this study might be less so.
Thanks. And your study really focuses on mortality, right? Which is obviously like the biggest component, but there
are studies that look at hospitalizations and so forth. I mean, I think the ones that I was sort of specifically comparing against were mortality studies, but certainly morbidity is also important.
Yeah. Great. Well, thank you so much, Michael, for joining and sharing about this super interesting research paper. We really appreciate it.
Thanks, Ellen.
So I'll go ahead and hand it off to Mehdi then to do Q&A with Eric.
Thanks, Michael and Alan. This was a great discussion. Now we move to Eric. Eric, do you have slides you want to share? Or all right. So we are fortunate to have Eric today here and to talk about the water transfer policy and how that affects pollution levels in the region. Eric, can you start just by telling us about the study region and what was the water policy, the elements and timeline? You are muted.
I always do that. Thanks so much for having me. And yeah, I'd be happy to tell you about the study region. So wait, I gotta get out of this real quick. There, that should be better. All right, yeah. So what I'm going to be talking about is in this paper is the air pollution effects of a water transfer that occurred in Southern California. So the study region is sort of the southern part of the state. Primarily, it's taking place between Imperial and San Diego counties, with some spillover into Riverside County, which we'll discuss. But it all revolves around the Colorado River, which is sort of the lifeblood of water in the Southwest. The Colorado River allocates about 4.4 million acre feet of water to California, of which about 3.1 million acre feet go to the Imperial Irrigation District, which is one of the largest irrigation districts in the country and one of the most valuable. They grow a lot of things like lettuce and melons and very valuable crops. California has historically used much more than their share of Colorado River water, up to about 5.2 million acre feet. So over time, that kind of became a problem with the other states. There was a lot of pressure to figure out a way of how to reduce that water use while continuing to provide water to the growing populations in Southern California, and in this case, in particular, in San Diego. So in 2003, the Imperial Irrigation District, under a lot of pressure from the federal government and the state of California, agreed to transfer water, some of their diversion water, which they take right here along in this purple canal, to San Diego. And the way that's transferred, there's no direct pipeline from Imperial County to San Diego County. That's just done with water accounting and diversions further up along the Colorado River Aqueduct here down to the San Diego Aqueduct. And so the transfer policy, and here's on the right, you can see a picture of kind of the south end of the Salton Sea there, which I'll talk about, and the Imperial Irrigation District. The transfer was for 200,000 acre feet per year, starting in 2003 and lasting 35 to 70 years. So this is billed as the largest ever kind of rural to urban water transfer. To give you an idea how valuable this was, in 2020, about 190,000 acre feet. So that's enough to cover 190,000 acres of land with 1 foot of water. Was transferred to San Diego for about $129 million. So Imperial generates the water through fallowing, on-farm conservation and system conservation. And the fallowing, which initially in 2003 was undertaken, was kind of controversial in Imperial County and among the irrigation district because it removes land from agricultural production. And there was worries of reduced agricultural production, reduced jobs. And so starting about 2013, this initial fallowing policy, which had been in place since 2003 and had these set-asides basically to keep water flowing in the Salton Sea, even as some was transferred out, changed. And so instead of fallowing fields and conserving some of the water to maintain flows into the Salton Sea, the water was just transferred via conservation. And that conservation didn't leave as much water flowing down into the Salton Sea here. And that's really the effect that we're trying to get out in the paper.
Thanks, Eric, for the background. And can you tell us a little bit about why we should expect water transfer policies to cause adverse environmental outcomes? Do you have examples from other areas that you can give us?
Yeah, so this paper we actually started when I'm at North Carolina State now. I did my PhD Santa Barbara, so that's my interest in California water policy. But this paper started when I was in Utah, and the Great Salt Lake is one example of this type of thing happening. So if we look at, this is a picture of just the Salton Sea where it has dried up, and what you see is this exposed lake bed, playa, is really susceptible to creating dust pollution. And here you see there's houses, people living right next to this exposed lake bed. So agricultural water diversions in general and any sort of reduced flows are really problematic for these what are known as the terminal lakes or saline lakes, right? So these are lakes, they occur throughout the world where rivers flow into an area of a low area and the water simply evaporates. So examples in the United States, as I mentioned, the Salt Lake, the Salton Sea, and then Owens Lake by Mammoth in California. And then throughout the world, the RLC is another example, and Lake Arima in Iran. All of these lakes are facing or have faced or are facing the same problem. And that's because as these rivers that flow into these saline lakes, their flows are reduced, they're perfectly balanced sort of in terms of evaporation with the size of the lake. So as their flows to the lake are reduced, for instance, in our case with these water diversions leading to less inflows, these very shallow lakes expose a lot of lake bed dust. And so the key example in California and where this has happened before, and many of you are probably familiar with Los Angeles's use of the Owens River, diversion of the Owens River. And if you've seen Chinatown, that's what that movie's all about. The Owens Lake was completely dried up for many decades, starting in the early 1900s. And at one point that had become the largest source of PM10. These are, in terms of the particulates, these are the larger particulates Michael was talking about, the largest source of PM10 in the United States. And this lake is not too far from the Salton Sea, actually. Like I said, it's up by Mammoth. There was a lot of dust pollution. There were emerging cancer clusters. Los Angeles lost some lawsuits and actually started investing in kind of restoring or preventing this air pollution in the Owens Lake. And to date, I think they've spent well over $2 billion mitigating those effects. And if you read about the RLC or Lake Arima in Iran, they're also drying out. They also have these dust problems. Salt Lake City in Utah is already in one of the most heavily polluted air pollution cities in the country, and they're facing significant potential problems from this sort of lake bed dust pollution.
Thanks, Eric. And can you tell us a little bit about this particular study and what type of data you used and the methods used to measure the effects on the pollution?
Yeah, so what we want to do is we have this sort of, I'm just going to jump back to my earlier slide here to show you. We have this county Imperial that's going to transfer a lot of water out, and to do it, they're going to reduce their flows into the Salton Sea. And what we'd like to know is what effect that had on basically on air pollution in Imperial County. Now, the trouble with just observing the raw data is that a lot of other things are happening at the same time. So there's changes in economics, there's changes in the level of drought in California. All these other factors could also affect air pollution. So what we're going to try to do is we're going to construct a synthetic Imperial County that's one that's going to be based on observable characteristics of other counties in California that aren't affected by the transfer. And this way we can compare to see how the change in water transfer policy affected Imperial County. And so to do that, what we do is collect a lot of characteristics on a lot of the counties in California. And then using the period before the transfer policy, we kind of figure out how the relationship that best models air pollution, say, in Imperial County, using data from the other counties. Then we can run forward and see how that changes relative to what actually happened in Imperial County. In terms of the economic outcomes, right? So one of the key factors here was that the economic factors related to jobs and agricultural production in Imperial County was a key driver of decisions in terms of political decisions on how the water transfer policy was implemented. And so in terms of these outcomes, we're going to look at what happened to acres and crop production, the number of people employed in the agricultural sector, and we expect these to decrease as fields are fallowed and ag production declines. And this decrease, I think, will be indicative of the sorts of political pressures that start to face policymakers and might lead to a change in policy. Then what we're going to look at is we're going to collect the Air County data in terms of several pollutants, and I'll talk more about this when we get to the results. But for air pollution, we're gonna be primarily interested in dust, right, blowing off of the lake, the exposed lake bed. And that's going to be these, as Michael was discussing, these particulate pollutants, PM 2.5 and PM 10, PM 10 being the larger one, PM 2.5 being the smaller. And then I'm just going to show this just to give you an idea. Starting in about 2013 and 2012, there's a little bit, we start to see these other colors emerging. And this is a chart of the amount of water conserved by Imperial irrigation districts. Starting about 2013, we see these other colors. The gray is this fallowing program that included offsets. That was water that was going into the Salton Sea to maintain its level to prevent dust from being, or more lakebed from being exposed. Starting about 2013, these system efficiency, on-farm efficiency types of policies, that's especially the yellow and the blue, start to increase. Those have no offsets associated with them. So those lead to declines in the amount of water flowing in the Salton Sea. And so what we're going to be interested in is, starting in 2003, what happens to jobs and agricultural outcomes and stuff in Imperial County. And then maybe starting around 2013, 2014, what happens as this policy changes, what happens to air pollution.
All right, thanks. And can you tell us what did you find regarding what happens to air pollution first?
Yeah, so what we find results that are fairly consistent with kind of our predictions here. So here on this first chart I have is the PM10. These are these bigger particulates. They're still pretty small, but you know, this is the sort of dust up in the air, the bigger particulates. And this is going to be our synthetic control plot. So before 2003, so to the left of that gray line, is our attempt to match the dashed line, which is synthetic control, or the synthetic Imperial County, with the actual Imperial County. And then to the right is what happens after this trade policy is implemented. The idea being that any differences between the dashed line and the solid line represent actual changes that have occurred in Imperial County. And what you see is, for the most part, at the beginning of the transfer period, there's not large differences. And then starting in 2013, but especially in 2014 on, there's this large increase in the number of PM10 days. These are days where the PM10 pollution, according to the monitors in Imperial County, are above the EPA's recommended or regulated levels. And so you see this big increase, and we can take the difference between that increase, and we can plot that. And these gray plots represent what we call placebo plots. This is just a way of gauging, is what's going on in Imperial County very different from what's going on, what would be going on just normally. And so we see that, especially after 2014, it does look very different. And so sort of in general, we look at PM 2.5, which again is this other dust-related pollutant, and we see a very similar trend. And if we look at what we call the gap plot, again, the PM 2.5 effects aren't as different than these gray ones, which is indicative of maybe being less abnormal than the PM10 results, but it still is a large spike up in the number of PM 2.5 days that we observe. Now, the interesting thing here is we have, and this is really contrasted nicely with Michael's presentation. There's sort of generally in Imperial County and a lot of places in California, the Central Valley, there's kind of this naturally occurring, or in this case, not so naturally, but pollution that's occurring because of dust and sort of wind picking up things into the air. And then there's pollution that's being caused by highways and cars and businesses through combustion. And so we can look at these two different types of pollution: combustion-based pollution, which is going to create PM10, PM 2.5, but also other byproducts of combustion like ozone and NO2 and other pollutants like that, versus dust, which there's no reason to believe that dust pollution is going to create additional ozone pollution or NO2 pollution, which are just byproducts of combustion. And so one of the things we do to test whether we think our air pollution is coming from dust is to compare the air pollution changes from the air pollutants we think are related to dust, PM10 and PM 2.5, relative to those that we think are related to other things. So for instance, what we might be worried about happening is during this time period, maybe there was a big increase in industrial activity in Imperial County, and that created a bunch more air pollution. Well, if that were the case, we'd expect all of our air pollution measures to jump up. What we see is generally after 2014, our PM10 and PM 2.5 measures jump up, but our combustion related air pollution measures don't really go up, or definitely don't go up. And so what that tells us is that the culprit appears to be for these big spikes in air pollution near the end of our sample period. And I'll note that the end of the sample period is exactly when we predict that the Salton Sea is going to receive the fewest amount of inflows from Imperial because of this change in policy. We think the likely culprit for that has to be dust and not increases in combustion or something like that.
Very interesting. Thanks, Eric. And you mentioned you also measured the impact of this policy on other economic outcomes like agricultural areas. Can you speak a little bit about the results you find on that?
Yeah. So one of the big concerns with these types of rural to urban or ag to urban water transfers is what is pejoratively referred to as buy and dry. And this can refer to an environmental outcome or an economic outcome. And that's essentially that, a rural community or a agricultural community like Imperial County and Imperial Irrigation District sell their water, and essentially they're selling away their base of economic production, as well as potentially their environmental amenities. And so what we want to look at in the project as well is, well, what happened sort of in environmental terms and in agricultural terms. So here I have this synthetic control plot for harvested acres. What happened after 2003, once they started fallowing fields, and you see, sort of after 2000, starting in 2004 and going on, there's this divergence between Imperial County, which is below the synthetic or the predicted Imperial County absent the water transfer. And so this suggests to us, and here's this gap plot again, this suggests to us that as we'd expect, the fallowing reduced the amount of acres in production in Imperial County. And necessarily because of that, we might wonder, well, what happened with employment in Imperial County, especially agricultural employment. And so we look at that as well. And in terms of our model, which we get into much more in the paper, we want to look at kind of low education and high education labor, although we kind of predict that both might decline. And what we see are these kind of apparently large labor impacts in Imperial County. So there's large divergence in jobs jobs in the agricultural sector as a result of the policy. Now, one of the caveats here, so these look like very large effects. One of the caveats here is you don't see what we would call confidence intervals, or some way to understand, how sure or unsure we are of the black line relative to the dotted line, right? So these large gaps are, appear to be different. As you can see from our gap plots, the black lines don't overlap with the gray lines, but the magnitude may be exaggerated by the point estimates, and we don't have a good way to show how uncertain we are about that. But the sort of the key takeaways here is that both the harvested acres, which we know there was a policy to fallow fields, over time, the harvested acres declined and ag employment declined. This is exactly the fear of sort of the Imperial County, and why they opposed, this transfer is very, very valuable to a lot of people, has been on the table and being negotiated between San Diego and Imperial since the 80s. And Imperial has always been reluctant to do it for precisely this reason, and that's this change in labor and this change in economic activity in Imperial County.
Thanks, Eric. And just as a last question, can you tell us a little bit about the policy implications of your work and recommendations?
Yeah, absolutely. So I think the first is the key policy implications sort of revolve around the two aspects of this. The first is just, it's important to think about the environmental outcomes of transfer policies, right? Especially if, the water that's being transferred is providing an important, what we call ecosystem service. Ecosystem service is the water in its natural system, in this case, in the Salton Sea, is providing a stream of benefits to people. In this case, the stream of benefits is limiting dust pollution. It's clear that stream of benefits is very valuable based on what's happened in Owens Lake, because Los Angeles has had to pay billions of dollars to try and try to provide that same service that the lake bed was providing prior to the diversion of the water. It's likely going forward, and it's already under discussion, that San Diego is going to have to start doing some of these same things for the Salton Sea. That is, covering these ecosystem services that the water that's been removed was initially doing. So that's sort of one aspect of the policy implications. The other is a little bit broader, and it has to do with trade policy. And that's that, we often talk about trade policy as being between countries, and we think about, things like tariffs and trade restrictions. And in those cases, economists have sort of suggested that tariffs and restrictions are not really designed to improve welfare. They're designed for political reasons, to protect particular industries, particular sets of jobs, things like that. And here we have a trade policy that's not at the national level, but at the, sort of the sub-state level, right? Imperial County and the state of California decide whether, Imperial Irrigation District and the farmers there can transfer water to San Diego, and how much and how it works. But we get the same sort of political considerations, right? Initially, the policy was designed to fallow fields and protect the Salton Sea, but that leads to job declines and reduced agricultural production. And so you get changes in the trade policy that are designed to promote economic activity in the Imperial and in the region, but may have had these adverse consequences in terms of health outcomes and air pollution. And then I also want to mention sort of the follow-on, or the key kind of questions remaining, right? So we've sort of linked linked water transfers to this air pollution outcome. But there's still a lot to be done to understand how this air pollution outcome is affecting health. Imperial County has one of the highest age-adjusted per capita asthma rates in California, or asthma hospitalizations rates. And so there's additional questions to be answered in terms of that, and also in terms of sort of some of the environmental justice implications of that outcomes, and who's being affected by this air pollution.
Thanks very much. And that was one of the questions that I was going to ask. Did you explore, or do you have any? Can you speak on the effects you find on portions of the population, or do you find these effects are larger for low-income populations or not?
Yeah, so I don't think this study sheds much light on that directly, but it's definitely a follow-on implication. What I will say is, in general, when we think about kind of applying environmental justice to this sort of economic analysis, and especially in this kind of political economy context, what you'd expect is that groups that are traditionally able to access power and be involved in decision making are going to be able to protect their interests better than groups that we would have environmental justice concerns about. So lower income, maybe traditionally marginalized minorities, maybe people living kind of on the fringes of, for instance, the Salton Sea, which isn't like the most expensive, highest rent area to live, might be particularly affected by these types of outcomes, and wouldn't necessarily have access to the types of access to political power and things to change the policy in their favor. So I think there's definitely reason to think that there could be some interesting questions to answer around those topics here, but we don't directly shed light on that yet.
Eric, could I ask you a question it's kind of a specific question from earlier slide. You don't have to pull it up, but you had these nice event study figures where you were comparing, the dust related ones, the PM10 and PM2.5, to other non-dust related particles as sort of like a kind of placebo test. And you showed the like NO2 and ozone, and it actually looked like there were significant declines in those ones. And I was just curious if you had some sort of explanation. Is it related somehow in an inverse way, or like what could be going on to potentially explain a significantly different, negative effect on those particulates?
Yeah, I mean, it's a good question, and one I've wondered about, especially with those particular event studies. Those are the Poisson regressions, I believe. The placebo tests are not, you don't see that same decline as much in the synthetic control studies, which we emphasize more in the paper. And I don't have a good explanation for you. I've kind of wondered if there's something about the increased dust that does reduce those. And it's something we've definitely thought about looking into further. It's a good question, because it is, I wouldn't say suspicious, but it is interesting that at the same time that the dust pollutants are going up, the other pollutants are going down.
Yeah, like I was wondering if there was some like physical connection that, I don't understand because I'm an economist, but like maybe there's something, related there. So.
Yeah, and I don't want to speculate too much. I know ozone is created when sunlight hits, and I know other types of pollution are chemical processes. So it might be worth looking into more. If there's a bunch of dust in the air, does that do something? And then do we have to think about that as something beneficial that dust provides? It reduces the amount of ozone. I don't know, but yeah, we'll look into that more. It's a good question, but I don't want to speculate anymore. But it's super interesting. Yeah,
sure. But yeah, the research paper is super interesting. I learned a lot. So thank you for thanks for sharing with us today. Go ahead, Mehdi.
I don't see any more questions from the audience. And thanks, Eric, for sharing the paper and speaking to us this morning. I would turn it to Ellen to conclude the webinar.
Yeah, I just want to take, before people take off, I want to launch another quick poll just as a way to help us, you know, to see if this information that we're providing in the webinar is helpful to folks. So if you don't mind answering these 3 questions, we'd really appreciate it. And while you're doing that, I just want to say thank you so much for joining us. You know, if you're a repeat from past area discussions, thank you so much for coming throughout 2021. This is, you know, obviously our last webinar of 2021, but we plan to be back in 2022. So stay tuned for more updates. You can always find information on our website at areadiscussions.ucdavis.edu. And feel free to email us at any time if you have suggestions for topics for future webinars or other suggestions in order to make this webinar, you know, better for the ag and resource community in California. Thank you so much, everyone, for joining us.